Hi, it's Jerry Roberts, and I'm back with our series of community conversations. And today we are talking with Renaissance man Andy Caldwell, the director of the Coalition of Labor, Agriculture, and Business for Santa Barbara County, a columnist, radio host, and most recently, the Republican candidate for Congress in the 24th Congressional District against Democrat Salud Carbajal. That seems like a long time ago, election night.
It was a different world back then. I'm 62 years old. I've never seen anything this cataclysmic in my life. The closest thing to it on a different scale was 9/11.
Yeah.
But I compare what we're going through to that to some degree.
Yeah. Well, we were just talking, you work at home. So what are you don't have to have a lot of stay at home social distancing things imposed on you. I guess what's your protocols for surviving the pandemic these days?
Well, so here's the deal. I've got asthma. I've had asthma all my life. And as I mentioned, I'm 62 years old. So I had to take the threat of the coronavirus very seriously. I was hospitalized 4 times in my life with asthma. That was when I was younger. They didn't have as good of medicines back then. But nonetheless, I almost died once. I came so close to dying, they told my mom they didn't know if I was going to make it. So I had to take this very seriously. So I was okay with the initial shutdown for a variety of reasons. One, I did agree that we had to empty out those hospitals to make room for the virus patients. I agreed that most of us were caught completely unprepared for having personal protective equipment, including our hospitals, emergency responders, and the like. And third, I agreed that giving us a little bit of time to flatten the curve was necessary. But my main focus and my main plea was to focus on isolating the most vulnerable. Now, I could have been one of those most vulnerable. I'm fairly healthy because of the medicines they have right now. But I believe that the people in the nursing homes and people that had heart ailments and immune compromised situations, I felt they needed to be in near total isolation until we figured out what was going on with this virus. However, I felt that after we achieved the initial criteria laid out by the governor, the surge, flattening the curve, personal protective equipment, and making room in the hospitals and all that sort of stuff, I felt the rest of us should have been able to social distance better at work than we could at home.
All right, let me ask you about that. So are you going out at all? Are you out and about, or are you staying pretty close to the range?
Well, my main job for CoLab, we've not had any meetings. We've canceled all of our meetings. And campaign-wise, we've canceled all of our meetings. The few county meetings I'm going to are on the phone or the internet. So I pretty much go out to fast food once a day. That's why I have such a great physique. And then I go to the radio station, and that's pretty much it. My wife and I will go take a drive and go to the beach or something on the weekend or get takeout, and that's it. So we've not socialized with anybody, and nor have I had any business meetings in person.
Yeah. Well, let me ask you first real quick about the campaign, and then we can get into the corona stuff a little bit more deeply. So late last year, you took leave of your senses and decided to become a political candidate, and you won the Republican nomination. But I dare say this is probably not what you had in mind about how the campaign was going to go. You're not even allowed to shake people's hands. So how are you conducting a political campaign, or are you?
It's difficult because I got into this late. I never had any intention or ambition to run. I got recruited, but I felt it was the right thing for me to do in terms of who I was in the community and my burden for our country. So I did get in it late, and we didn't know how much money we could raise. So we decided on day one, we had to do everything grassroots. So we built a campaign. We raised $500,000 all through meet and greets, primarily in people's homes or in their barns, or a few of them in a country club or a clubhouse setting at their condo association or what have you.
Yeah.
It was all hands-on, personal meeting and greeting. We raised all of our money and got all of our volunteers that way. We had meetings as few as 10 people and as many as 250 had showed up at these events. Sometimes I did 3 in one day. So with regard to that, I'm dead in the water right now, because that's the only, for instance, Salud Carbajal got a huge chunk of his money from PACs. All what he had to do is have his name on a list, and they sent him literally hundreds of thousands of dollars. I got something like 99% of all of our funding for people in the district who I personally met. And so right now we're hurting because we've got to do it a whole different way. And for a challenger, that's really hard. And then plus the impact of the coronavirus, we can't take corporate donations as a federal candidate. So it's got to come out of people's pocketbook. And right now people are hurting. So it is extremely difficult to campaign right now.
Yeah. Yeah.
But we're using Zoom, and we're using Facebook, and we're using all the other media and the old-fashioned phone. So we'll trudge on through.
Okay. All right. And then I think we still got a date in October, no, at KEYT for a debate. Last I heard, October 19th, that was still on.
Well, we had one scheduled previously on KEYT, and he chickened out. And tell you the truth, right now, he's not in Congress. The way one of my friends put it, he's AWOL, absent without legislation. And I think he should be on here right now with me debating over the federal government and even the state government's response to COVID-19. This is the biggest crisis that's hit the American economy in our lifetimes, actually the global economy.
Yeah. And
I think he should be showing up and being able, so voters can see a comparison and a contrast of values, ideas, and ideologies as to how we get out of this. So I want to come on your show. I want KEYT to do a debate and a few others to host these, because it's a time to demonstrate leadership, but not leadership in a vacuum of comparison and contrast.
All right. Well, let me see if I can set that up. I don't know if I can.
He's not busy. I can guarantee you he's not busy.
I've only done this with 2 people. I suppose there's a way I could learn to do it with 3 people at a time, but I'll follow up on that. That's a good question. All right, let's talk about the virus. And I just want to read you this quote. It's from Governor Cuomo, but I think it sort of sets up what the central dynamic is that's going on. He says there's a cost to staying closed, no doubt, economic cost, personal cost. There's also a cost to reopening quickly. Either option has a cost. The faster we reopen, the lower the economic cost, but the higher the human cost because the more lives lost. That is the decision we are really making. What is that balance? What is that trade-off? And you were kind enough to send me the stuff you've been writing about the virus. And, I think it's fair to say that on that trade-off, when you calibrate that continuum, you come down more on the side of that the economic cost has really begun to outweigh the public health cost. Is that a fair statement?
It's even more than that. The cost of the shutdown is now having a more serious health impact than the virus has. So, and I didn't send you this morning, and we knew this going in, COVID-19 did not cure heart attacks, strokes, emphysema, melanoma, cancer, valley fever. It didn't cure all these things, but all the routine diagnostic preventative, and even surgeries to deal with these things got canceled as if they could put everything on hold. Our jobs, our health and well-being, and the status of the economy, the well-being of the status on the economy. They actually had this, bias, a selection bias to pick out one ailment, and it is a real ailment, it is a bona fide ailment, to the detriment of everybody's health and well-being. So right now, you look in our news here locally, Samson clinics on the financial ropes. These hospitals, today, there's emergency room hospitals all over the country and specialists all over the country that said, we're down 2/3 the number of people treating with heart ailments, stroke indications, and things like that. Because, and this is my phrase to capture this, these politicians and the so-called experts they've relied on are literally scaring us to death by other causes.
All right, let me just push back a little bit. First of all, the virus is a pandemic, and I know you hate that word. I read your column about that, but that just means it's everywhere. Right. I did read a story this morning about American Samoa, and they don't have a single case there yet, which is pretty good. In addition to that, the humans have absolutely no immunity to it. And then I think that, and we've all become obviously amateur epidemiologists, but I think that the dangerous thing about it is what this R naught number. In other words, if you take the number 1, how many people will be infected by each person with it? And the flu, the common flu, is about 1.28. Coronavirus without any social distancing or shutdowns is about 2 to 3. So I think that gets to the contagious issue of it. And so that absent all of these steps that were taken, would we not have been seeing many, many more than the 75,000 deaths that we've already seen in the country and the 2,500, in California?
No. And I'll tell you why. No. And I'll tell you why. So here's the deal. As a result of me not doing much with Collab or the campaign, I've been sitting in front of this same computer screen for 3 months. Plus, as you know, my radio show is not me yakking my head off and spouting my own opinion. I interview 4 people a day. I've interviewed probably 40 to 60 people on my radio show over the course of this coronavirus outbreak.
But listen, Andy, you get paid a lot better for doing it than I do. I got to say that.
Well, thus far, I don't know how much longer that's going to last because we're a C6, not a C3. That's another story. So here's the deal. For instance, the cruise ship, there was 3,700, and I got this idea listening to the Cottage Hospital infectious disease expert giving a 1-hour talk to the fellow doctors. She said, look at the cruise ship. It's a bucket. That's what she called it, a bucket. It's a closed community. We can look at the spread of the disease in this ship because there was nobody going in, nobody coming out, high concentration of people in a relatively confined space. Well, some of the people that got sick who tested positive were crew members that had interaction with a whole lot of other people. Out of the 3,700 people, 7 or 8 died. Several hundred had the disease, didn't require hospitalization. And all the rest of them, the other 3,000, walked away with nothing, either asymptomatic or never caught it to begin with. The other issue is on the cruise ship. No, let me just clarify. They were confined to quarters, though, on the cruise ship. They were quarantined. Yeah, but that was after they knew the disease was on there and it spread. And so the best example right now is Sweden. So at first, everybody was condemning Sweden because they did a little bit of social distancing, a little bit of that, a little bit of this. They did not shut down their economy. And their disease rate now, the WHO, first of all, they were getting condemned by everybody. Last week, the WHO said Sweden was the model. And the way this one doctor from Stanford put it, and I don't understand disease, I admit I'm no doctor, epidemiologist, but this is the way the one doctor from Stanford explained it. Those 80% of the people that get it but show no symptoms, they are the perfect people to give the rest of us herd immunity, because they've been able to handle it. And by actually being in contact with them, we get herd immunity versus being shut down and then waiting for the disease to quote unquote find us. And right now, for instance, in Cuomo in New York, 66% of all their new cases are people that are quarantined at home. And this gets back to an early point. Let me just share this last point and then I'll let you come back.
Thanks.
So when people are in
Remember, it's my show.
I'm sorry, I apologize. But when people are in their office, most of them have their own workstation, cubicle, or office. They're not sharing a phone, a computer screen, or a desk. I believe it would have been easier to social distance at work, because people at home are not going to wipe down the microwave oven, the kitchen sink, the bathroom toilet, or the remote control. They're not going to wipe down things. They're not going to wear a mask in their house. I believed it would have been safer for us to go to work. That's it.
All right. No, I understand your perspective. And I mean, first of all, on Sweden, I saw the Swedish health director on television, I think 2 nights ago. And he said he has been very surprised by all of his modeling at the large number of deaths that they have had. And by any measure of their neighbors, they have had many more deaths. So I think the fatality of it surprised him. But here's the thing. We're at 75,000 deaths, 2,500 in California. You know, we're still not looking at the peak of this until August, as I understand it. And the model the White House is using is saying 135,000. So, you know, I want to go back to that original question of how do you calibrate the trade-offs? What number of deaths is accessible from this disease until we have widespread testing, quarantining, and tracking people until we have a vaccine? What's the acceptable number of mortality there?
Well, I didn't want to hold the chart up because I thought it would look kind of cheesy, but we're past
listen, if I'd known how to put it in, I would have put it in.
It's all right. I'm pretty darn sure I'm more technically challenged than you are. So here's the deal. We're past this crisis. Governor Newsom keeps moving the goalposts. If you recall, first of all, when you're looking at a chart that's put out by the Public Health Department these days, the chart starts March 15th. That's when the shutdown started. We didn't get this disease in March 15th, the day of the shutdown. It's been confirmed to be in California since January, but many doctors, including a couple I've talked to, said it's been here since December, because it got here not much longer after it hit Wuhan, because California has daily flights, multiple daily flights to and from Wuhan. So we believe that the disease at a minimum has been here since January. So it spread January, February, and into March. And in fact, it even kept spreading afterwards, obviously. And they kept telling us, we're going to hit this peak in 2 weeks. 2 weeks later, they said, we're going to hit this peak in 2 weeks. Now they say we're going to hit it in 2 months or 3 months. But the data is, and the county's real data, is that we hit the peak in the middle of April in terms of the number of confirmed cases that are versus the number of recoveries. Those lines crossed, and the number of recoveries is now approaching the total number of infections, while the number of people still with it is approaching 0.
All right.
And here, let me tell you the trick they're playing on you, Jerry. The more people you test, the more cases are going to be discovered, but the vast majority of those people are asymptomatic.
I know, but I'm asking about deaths. I'm asking about people's deaths. You just said we're past the crisis. I just want to clarify. When you say we are past, do you mean Santa Barbara County or California or the U.S. or the world?
Well, let me clarify it on 2 levels. The people in the hospital they're not past the crises. The people in ICU, there's a darn good chance they're not surviving the crises, and my heart's out to them. So you've got to separate the real data that you need to look at as hospitalizations and ICU, and within hospitalizations, ICUs and death. So our death rate, our death line on that chart I sent you, which is the county's actual number, has always been flatlined. There was never an exponential rise in the number of people hospitalized, the number of people with infections, and or the number of people who died. It's always been a steady trickle through 440,000 people in this county. And the point is getting a vaccine and or getting a cure to this thing could be a year away.
Oh, at least.
We won't have an economy left by that time. Government,
right.
This is my big criticism. Government's giving away money they don't have right now because they get the money from the economy they shut down.
All right, I want to talk about the money. Let me just close on this, on the public health piece, because yesterday, our neighbors to the south, LA County, reported the most new cases and deaths that they have had to date. So we're only 90 miles away, and to say we're going to reopen the economy down here, we're a tourist economy, an entertainment economy, hospitality, and so on and so forth. Aren't we going to just be, and this is a good way to transition into the economy, opening ourselves up to people who say, oh, Santa Barbara's open, I'll drive up from LA for the day or for the weekend or for the week.
Okay, so I agree that we're not over in terms of incidents because this thing has to play out. However, there's a number of professors, epidemiologists in the world that say most all viruses are what they call self-limiting. That on average, they believe this virus has about a 70-day lifespan in terms of its transmissibility throughout our society. That's why, and let me get back to deaths. Not all deaths are created equal, so to speak. So in Italy—
Especially when it's mine.
Well, exactly. So in Italy, when they, and this is our audience needs to listen very carefully to this. In America and in Italy, if you had coronavirus, they said you died from coronavirus. But that doesn't mean that that's the truth, because, for instance, there were people in hospice.
That's the same calculation as on the flu, is it not?
It can be, but the point is somebody that was in hospice before the virus spread, and then they marked the death by virus when they were already in hospice. So what the doctors in Italy said is 60% of the deaths in Italy, those people would have died within 6 months from some other underlying cause.
This is what bothers me. When you guys, I feel very Malthusian about this. You know, I'm like a 71-year-old guy with a rotten immune system, and you know, I'm on Medicare, I'm on Social Security, so I'm one of the prime candidates you're going to put out on the ice flow here. So I just get a little concerned that it's, oh, these people were all going to die anyway. That's just troubling. Let me ask you about the economy.
Well, can I respond to that?
Real quick, though.
I would tell you, with all due respect, stay home. Okay? And me too. I'm going to be careful. Once they quote unquote reopen the society, for instance, I'm not going to be shaking hands for a long time after they reopen society, because you know, this thing can linger in some way, shape, or form. And then plus there's other stuff out there. But the fact that we've never quarantined healthy people to not catch a disease versus quarantining the ones that had it and could. And here's the other deal.
Right, but you're a student of history. You're a student of history. I know, Andy, and you know as well as I do that the deadliest part of the Spanish flu epidemic, which is the only really thing we have to compare it to, came after the first shutdown. It was in the second wave when people declared mission accomplished. We won. The crisis is over.
Well, there's a lot of different things. Part of that was tens of thousands of people coming back from the war. And the sanitary conditions back then were a lot different than they are. Medicine was a lot different than it was. There was all sorts of different factors back then than we have today. So I think it's instructive on how deadly a pandemic could be. But I can tell you the reason they have inflated the numbers on the R naught and the mortality or fatality rate, they've never known what the denominator was.
Because we
If
didn't
they
have
don't know
enough
what the
tests.
denominator was, they don't know what the fatality rate is.
All right. We could talk about this all day, and you never had me on your show, so I can't do that. But
I'd love to have you on my show.
let me ask you about the economy, because here's what I don't understand. When we keep talking about, reopen the economy, what is that going to look like? Because my sense is, and this is, there's a lot of polling, but I don't know. My sense is people aren't going to want to go out. People are going to vote with their feet. Are they going to be going to a restaurant? Are they going to be going on public transportation or to a conference or get on a plane? What is that going to look like? If you had your way and you could reopen the economy today, what would that look like?
Well, you're absolutely right. And I'm just going to give you a bit of anecdotal evidence. My wife and I sometimes go to the Cocos up in Pismo Beach. And about a week before the governor issued a shutdown order, we were the only people in the restaurant. And I do believe they have scared people witless in terms of there's a lot of people that are going to be very hesitant for a long, long time before resuming. So in other words, even if we open the economy wide open, I do believe it'll be a long time before we have reintegrated into society and into the economy in a successful way. I do believe there's going to be residual damage from the shutdown. And let me just say this. So right now, earlier on, they told us don't wear masks, don't wear N95 masks because we needed to save those for healthcare providers. And in reality, the only type of mask that will protect you from the virus is the N95 mask. Well, now they're telling us, like LA and Sacramento and a few other places, if you're outside, you've got to be wearing that mask.
But it's to protect others, is it not?
Well, but here's the deal. Here's the
it's
deal,
to protect
Jerry.
the others. I'm protecting you with it.
Okay, right? So let's say I accept that. Then why can't we just all wear masks and go back to work? Right now, if a mask protects you to the point they're requiring them, and they're saying, like I heard at Rotary this morning on Zoom, oh, they're 100% effective, then why not give everybody a mask and let us all go back to work?
Well, I thought that's because that's the part about the mask is the aerosol transmission, but it is much more frequently spread on surfaces, whether it's metal surfaces or wood or doors or doorknobs or anything.
Right. Well,
I mean, I'm cleaning my doorknobs every Saturday. I go.
And you live by yourself, right?
I'm not too fair.
Then you know what? Then carry a little thing of hand sanitizer with you. All I'm trying to say here is let me give you a couple of illustrations. Let me tell you the illustration of our shutdown. I had the president of the largest hotel association in America. His members own over half of all the hotels in America. They're losing $500 million a day. Our medical sector is something like $17 billion a week, I think, for them. The number is staggering. And, Salud Carbajal is out there trying to help. He's basically trying to get more money to people. And on the one hand, that's commendable. But my criticism of Congress, and this is both parties, none of them have told us where we're going to get the money from. And I know from basic economics, the American economy is the source of the money that the politicians are handing out. And they didn't have an extra $2 trillion or $4 trillion lying around.
So would you have voted against those bills?
I would have voted for them, but I would have insisted that we had a plan on how we're going to pay for them and been honest and upfront with the American people of what we were going to have to cut or how much debt we were going to have to put onto our kids and grandkids in order to do this. And I would have pushed to get our economy opened as soon as possible, because there is, the way John Capalla, the Howard Jarvis taxpayers put it, our house is on fire and we're hosing it down with cash.
All right. Hey, listen, I really appreciate you coming on, man. I have the free version of Zoom. I'm too cheap to pay for it. So I time out after 40 minutes.
I'll send you a check.
That's good. But I will, I'll follow up with Salud. I'll see if I can get you both on at one time. That would be interesting. I think that would be a very good exchange.
Must see TV.
Must see TV. All right, Andy Caldwell, thanks so much for joining us, and stay healthy, okay?
Thank you. You too. Stay isolated.